My name is Dr. Samir Patel. I'm a clinical microbiologist at Public Health Ontario. I provide clinical expertise in antimicrobial resistance testing as well as vector-borne zoonotic diseases. So next generation sequencing is recently developed technology, and this is where we are analyzing nucleic acid or DNA from a specimen, patient sample. And you're able to analyze both human DNA as well as to identify whether or not that particular patient sample is containing a bacteria or viral DNA or not. So you're able to identify bacteria or viruses from these pathogens using this technology. This will allow us to systematically and definitively determine whether or not a patient is infected with bacteria or viruses. If indeed a patient is infected, and if we identify either viruses or bacteria in the sample, then the patient can be managed appropriately, either with antibiotics or antiviral therapy. This can also be used to control spread of disease as well. So patient can be put in, and appropriate infection control practices can be implemented as well. Once it's established, is that this will allow us to systematically identify a pathogen or viruses or bacteria from a sample that is otherwise routinely tested and was negative for the routine bacteria and viral testing. So if you think about it during the SARS, where initially we had no idea what was causing the outbreak, and it took us approximately 3.5 to 4 months to identify SARS viruses. The pathogen discovery program will allow us to systematically analyze the samples during the outbreak situation. It'll allow us to rapidly identify what is causing the outbreak. So this will allow us to appropriately put in control measures to prevent spread of this outbreak. At the patient level, it will allow clinicians to manage the patient appropriately, whether with antibiotics, whether with antiviral, or other treatment modalities. So this is still in the validation phase, but what we see in 3 to 5 years, we will be able to implement this testing in a routine clinical testing. So this will allow us to timely and accurately provide results to clinicians who can use the results from this platform to manage patients appropriately.